Hello friends, myself Dr. Pradeep Tiwari, and as you all know, the National Board of Examination has, announced the conduction of NEET SuperSpeciality examinations in November, that is 13th and 14th of November, and by 30th November the results will be out. So your course will be commencing by the next year, January, 1st of Jan 2022. And the most important thing which comes as a shocker to all of us is that the pattern of examination has changed suddenly. Just 2.5 months, left for the examination, and they have come up with a new pattern of examination. So there's a lot of discussion about it, whether this is good or whether this is bad. But the point is, whatever the pattern is, the time is so short that you, instead of wasting time and discussing a lot about why why the pattern changed suddenly like this, I think it's better to focus on the time that is left with you. And there are certain good positive aspects about this change. So I will be sharing this prospectus that they have issued. Yeah. So here it is. So in this prospectus, I will let you know certain important things that you need to know. So the date of examination and everything you already know about it. So this is the notification about the date of examination. So it's on the 13th and 14th of November, and results will be on the 30th of November. And the course commences on 1st of January next year. One very important thing that I want to show you here is, this particular thing, which is a lot of debate has been there about. Yeah. So we'll see this. Basically, what they have done is they have divided this whole super specialty, into medical group, the surgical group, and the pediatric group. So the medical group will have a single entrance examination, and with that examination, they can actually choose about these specialties, that is cardiology, clinical hematology, and all those things. They can actually choose from these 12 specialties from a single examination. So that is a big plus. So you don't have to, you are not restricted to one particular field. And when you have the result, you can actually decide, depending on the institute, you can actually decide whether you want a branch. So that is a big plus, here. And this was the original pattern of NEET SS. The first NEET SS that took place in 2017. This was the pattern of examination that was there. So this is again being repeated. It is, a good thing, because you have a lot of time. You can think about it. You can balance the institute and the branch both, and you can actually, if you have made up your mind to take some certain branch, and suddenly you realize that you are getting a good institute of some other branch, you can rapidly transfer yourself from one specialty to the other, and from you can actually get a degree done from a good institute. So that is a big advantage, because in the previous pattern you can only give for the two super specialties, and if you have not secured a good marks or a good rank, you are totally out of the counseling process. So this is one big advantage. Second important advantage, for the medicine people especially, because these examination, these specialties are, only reserved for them. The pediatrics people cannot enter into that. So the pediatrics people have to give a examination from the pediatrics group. So they will be eligible for the pediatric hepatology or pediatric nephrology. So pediatric people going into the medicine adult field, that has that gets restricted. And at the same time, certain specialties, like pulmonary medicine, which previously medicine people could take up. So this is again getting reserved for the MD and DNB respiratory medicine. Also critical care, where a lot of specialties were eligible for the critical care. So now the MD anesthesiology will be the main people who will be eligible for the critical care. So that comes as a advantage at one point, and even a disadvantage, because a lot of pediatric people will be unsatisfied. They wanted to go into the adult one, but now they will be restricted. So this is plus for the medical group and minus for a pediatric group. But I think this is a fair pattern, because I have personally worked with pediatric people in adult neurology, and the combination is a bit weak, because they haven't seen even basic cases like stroke, and the medicines that for the hypertension or the diabetes that you use for the geriatric age group is quite different from that you use for the pediatric age group. So they have a tough time, because initial 1 or 2 years they take time to get acclimatized to the medicines, the medicine kind of specialty, and then they from there they pick up into the super specialty. So in a way, you can debate about this even longer, but I would say that in a way this is good for the super specialty, because there is a basic segregation is required, where neurology or hepatology has to be divided into pediatric neurology and adult neurology, and the adult one will definitely be handled better by a medicine guy than a pediatric guy, and at the same time the pediatric one will be handled better by a pediatrician rather than a adult medicine guy. So in this way this is good. I totally agree with this. So this is one important aspect. Second important thing that I want you to know is, yes, virology will be open for the microbiology, and intervention radiology will be open for the radio diagnosis group. So yeah, and ops gynec will have the gynecological oncology as well as the reproductive medicine. So in a way, they have segregated things, made it more clear, and so that people from one particular subspecialty can only enter into a super specialty. Totally fine. And here they have given 150 questions will be there that you have to finish in 2.5 hours duration. I want you to know about this. Yeah, the correct response gives you 4 mark, and the incorrect response gives you it removes 1 mark from your marking. Now this is important, because whenever you approach a MCQ based examination, now here's the trick. If you can actually eliminate, when you read a question, a lot of times you will have you won't get the answer. So you read the options. If you have 4 options and you can eliminate at least 2 options, so you get down to just 2 options, and you think there's a 50% chance that this one will be right, it's still a very safe attempt to go ahead with the question and mark the question, because suppose you attempt 20 questions with 50% possibility, you will end up getting more positive marks than negative marks. But if you cannot eliminate 2 options, or you have totally not heard about that question, you have totally not studied about that question, it's better to leave that question. So the basic MCQ pattern knowledge, MCQ pattern teaching, that you eliminate the options, and if you are left with just 2 options, it's a fair chance to go ahead with the question, to mark that question. So this is again important in dealing with multiple choice questions. And obviously the examination will be in over 2 days, because we are having many subgroups, and all subgroups have different papers. So that is one important aspect of this. Yeah, so this is what I wanted you to know. So coming back to this NEET SS examinations, and this, why this is good, why this is bad. So I've already told you why this is, in a way it is good. But at the same time, I want you to know that, especially for the freshers, this will be a very important time, because you will have an equal chance of, getting into the examinations as compared to people who were, preparing since long time. So this is one big advantage. People who have just passed out their MD medicine or MD pediatrics or MS surgery in June, July, even they stand on the same boat as people who spent a lot of time dealing with the super specialty. So this examination will be more of an exit level examination than an entrance level examination. Your basic feeder subject, or the basic subject from which you have just passed out, knowledge about that subject will be more important than the knowledge about super specialty subject. This is one important thing. And for that, a lot of people were taking MCQ books and courses for respective super specialty like neurology or hematology, and they were putting a lot of input into it. Instead of that, people, the basic the basic preparation like solving Ajay Mathur or solving Deepak Marwa, going through Harrison or going through Nelson pediatrics, that will help you a lot. So in a way, the content has reduced, because in previous pattern of examination, you had to study for the feeder subject as well as for the super specialty subject. So content of the examination has reduced. You can finish the MCQs in Ajay Mathur in a span of 2.5 months. So this again is a plus point. So I want you to know that there's good things about this pattern as well, rather than what people are propagating and all negativity that is only bad thing about this kind of a specialty. Obviously, certain specialties will feel betrayed and certain will gain out of it. But then overall, for the medical education purpose, this is a good approach. Only thing, that time duration in which they informed us is quite short. Like you only have 2.5 months, and people who were repeating, they will be at a big loss, because they spent a lot of time with the super specialty subject, and ultimately it will be the feeder subject. And the freshers one, the freshers will be more well versed with the Harrison and the feeder subject like medicine, so they have again a good chance of scoring well as compared to the repeaters. So this will be a good competition on a whole, because everybody now will start afresh and everybody will be there in the same boat. So one thing is that don't fall into this trap, why this happened and this should not have happened. A lot of negativity going on around. Instead of that, the content is less. Keep your focus on trying to finish your feeder subject, and you will definitely score well. So take opportunity, don't take the negative out of it. And ultimately, in life, there are optimist people, there are pessimist people, but the people who will be successful will be the people who will be opportunist. So be an opportunist. There's a lot of opportunity as well in this examination. Make full use of it. And for people, especially in the medical group, I would say that you go through a book known as Ajay Mathur, where there's a lot of questions. There are 15,000 MCQs from the Harrison that has been given. And in beginning of each and every MCQ section, there will be important topics that will be put up there. So if you have time, go through Harrison for specifically that important topics. You cannot go through the complete Harrison, each and every line. That will be very difficult in last 2.5 months. Your portion won't get completed. Your target should be completing all the major topics of all the specialties, the hepatology, the neurology. So remain focused on that. All the important topics are written, before you solve the MCQ, there's a heading. So jot down all those important topics. If you get time, just go through Harrison about especially with those important topics. And first attempt should be made to complete each and all MCQs, and mark those important MCQs that you could not attempt or you got it wrong. And then in the second reading, make sure that those MCQs which you did wrong, you again pay focus on it. So you kind of revise the whole thing twice. So that will help, because most of the time, the NAT board actually picks up questions from already made MCQ books, or already questions that have come up in national board examination previously. They have a question bank, and computer actually selects out of it randomly. So if you have solved all those questions, you have a pretty good chance, of getting most of the questions correct in this examination. And as I told, this is a exit level examination rather than entrance level examination. So you pay more attention on your basic subject. Don't try to spend a lot of time with the super specialty subjects, because that will be very difficult to complete, because super specialty itself is a very big topic, and trying to complete each and every super specialty, that will be waste of time. You don't have that much time, actually speaking. So keep your focus, and 15,000 MCQs, with dedication, you can do in a span of 2.5 months. So don't feel a lot negative about this whole scenario, and get over it quite quickly and start preparing, because in this competition, everybody is at the same level. So if you start early, finish early, revise at least once important MCQs, you have a fairly good chance of securing a super specialty seat. Also, one thing I wanted to know is, a lot of people after securing a rank, they have called me and they have asked which super specialty should I take. One important message that I want you all to know is, because there's a lot of uncertainty in the kind of examinations that we are giving. There's very much uncertainty about the kind of counseling process that is going to take place. There's uncertainty about reservations that are going to take place. So overall, I want you to know, if you get a decent branch and if you are very comfortable with it, like you can spend your life with it, just take the branch and proceed ahead, because you need to start early in that particular subspecialty as well. So starting early will be one important point. Second important point is, because there's a lot of uncertainty. You prepare for one particular pattern, suddenly the next year there will be some other pattern which is coming up. And now that you have all the specialties at your hand, you can select from each one of it. It will be really good. And do select branches, and try to get out of this entrance examination and this field of uncertainty. After you get into a field, how you perform in that field is what actually matters. And believe me, in a span of next 5 to 10 years, there is going to be enough competition in all the fields. So people think that certain fields like neurology and cardiology have a lot of competition, but the patients are also large, and certain fields like rheumatology are rare. But in a span of next 5 to 10 years, you see there will be rheumatologists and even endocrinologists in every nook and corner. So the competition is daily rising. The number of DNB seats, the number of DM seats, MCH seats, the number of MD seats, fellow seats, everything has increased in the span of last 5 years. Seats have almost become like double. So you will face tough competition wherever you go. Even if you practice within general medicine uh, cadre, you will have a lot of competition. So my point is, take something decent and just try to go ahead with your life, with your specialty. Don't get stuck around trying to prove a point that you are brilliant and you can score a big rank. Ultimately, when you sit in a clinic and patients come to you, it's your skill and the way you talk, the way you can take people into confidence, that will actually count, rather than somebody, you don't come and ask people that what was your DM entrance rank before you ask a prescription for a doctor. So this is what I want you to know, that don't be stuck around with these examinations. They are very uncertain. If you get something decent, go ahead with it. All fields are good. All fields have decent competition. In next 5 to 10 years, every field is going to be pretty much saturated. So all the wishes from my side. Don't waste time, especially listening to all negative things. The pattern is pretty much clear. You have a single examination. You know what you want. You have to read. The content is less, so start reading rather than wasting your time. And in the due course of time, due course of weeks, I will be trying to put up videos regarding certain important topics, especially in neurology. I will do first, and then let me see what all topics I can cover. So stay tuned to my channel. If I get time, I will definitely try to cover as much as possible, although time is very less on our hands. So all the wishes from my side. Take care, do well, and see the positive out of it. Don't spend a lot of time trying, cribbing about whatever happened, because in the end, everybody is starting afresh. So it will be a pretty good competition to see. All the wishes. Thank you.